Hi, it's Patrick Hutzel from Intensive Care at Home, where we provide tailor-made solutions for long-term ventilated adults and children with tracheostomies and otherwise medically complex patients by improving their quality of life, and where we also provide tailor-made solutions to hospitals and intensive care units to save money and resources whilst providing quality care. In last week's blog, I shared home healthcare in Australia in crisis. Medically complex and ventilated patients are referred to the NDIS. You can check out last week's episode by clicking on the link below this video. In today's blog, I want to share another case study from one of our previous clients. Intensive care at home services for a 15-month-old toddler, another win-win situation and success story. Intensive care at home was privileged to look after 15-month-old Jacob, who was in NICU and then PICU for the first 12 months of his life. Most of the time during his first 12 months of his life, he spent on life support, more specifically on a ventilator with tracheostomy. More than once, the family was told that Jacob wouldn't survive, but thankfully Jacob turned out to be remarkably resilient and he has been beating the odds. Jacob eventually got discharged home with the help of our service, where we then provided up to 24/7 care in the home. Jacob had a tracheostomy, was oxygen dependent, as well as having a PEG tube for feeding. Initially, Jacob went home with a nasogastric feeding tube, which became dislodged quite frequently due to reflux, chronic nausea and vomiting, as well as Jacob pulling it out quite frequently. The vomiting eventually subsided after Jacob had a fundoplication and a PEG inserted. We worked with Jacob and his family for 4 months until Jacob had the tracheostomy removed and got decannulated after about 4 months of providing up to 24/7 intensive home care nursing. Jacob had the tracheostomy removed during a surgical procedure and it was successful. Without the involvement of a professional and specialist service such as intensive care at home, where we send ICU, pediatric ICU and neonatal ICU nurses in the home up to 24 hours a day, Jacob would have either stayed in the pediatric ICU or could have potentially died at home due to complications including but not limited to inadvertent decannulation of the tracheostomy. And those issues can only be safely managed by trained and highly skilled and experienced ICU and pediatric ICU nurses. Jacob was born prematurely and he had the following medical conditions. He had chronic lung disease in neonates, he had cerebral palsy, he had an acquired subglottic stenosis in newborns, he had congenital tracheomalacia, he was obviously tracheostomy dependent, he was oxygen dependent, he had regular and chronic lower respiratory tract infections as well as upper respiratory tract infection, he had GORD, and he had frequent desaturations to less than 92%. Jacob initially on discharge to home wasn't very well and he had numerous challenging clinical situations to go through before he was getting more stable. This was partly due to ongoing vomiting and the risk of aspiration due to the vomiting. Without having ICU and pediatric ICU nurses in the home, Jacob would have lived in a sterile pediatric ICU environment due to his medical condition and his family wouldn't have been able to go back home. Due to our professional service and having the skills and expertise available up to 24 hours a day to keep a toddler with a tracheostomy and oxygen dependency out of ICU, also enabled his parents to go back to work at least part-time. By using a professional and fully accredited service like intensive care at home, the Department of Health was also able to cut the cost of the ICU bed into less than 50%. Furthermore, the in-demand ICU bed was freed up and was ready for use for other critically ill children. To summarize this success story and highlight the win-win situation. Number 1, Jacob was able to go home after prolonged pediatric and neonatal ICU stay with the help of a professional and third-party accredited service who sends ICU, pediatric ICU and neonatal ICU nurses in the home. Number 2, an expensive and in-demand $5,000 per bed day ICU bed was freed up for use of other critically ill children. Number 3, the cost of specialized intensive care services was reduced to less than 50% of the cost of an ICU bed in a hospital, while still providing the same level of service in a home care environment. Number 4, Jacob and his parents were finally able to leave hospital and have quality of life at home. Number 5, Jacob's mum was able to go back to work part-time to support her family. Number 6, Jacob eventually had the tracheostomy removed, which is synonym to decannulation, but was able to spend the time at home before decannulation. Number 7, specialist services that were provided included tracheostomy care, oxygen management, monitoring, PEG and nasogastric tube management, suctioning, tracheostomy tube changes, respiratory management such as nebulizer application. Number 8, medications can and are administered by specialist nurses in the home with the provision of a medically prescribed drug chart. Number 9, nebulizers, analgesics and other PRN or as required medications can therefore also be administered without parental intervention, as is often the case when families have only support workers or untrained staff in their house. Number 10, chest physiotherapy and specialist nurses effectively deal with emergency situations in a calm manner. And number 12, our team of ICU and pediatric ICU nurses were working with Jacob have a total of 100 years ICU and pediatric ICU experience, therefore making the environment safe and stable for Jacob and his family. It's another success story, and it's another sign that medically complex patients with ventilation, tracheostomy, oxygen dependency, PEG, etc. can leave hospitals and ICU or pediatric ICU safely when looked after by professional intensive care at home nurses. You can also check out other case studies here. And I also should give some context here that in the past there have been children at home that haven't been looked after by intensive care nurses that were on ventilation or tracheostomy and had other medically complex issues, and they actually died. We have evidence for that. And the Department of Health, thankfully, is changing their mind now, and they fund what's medically required for those children, and they fund intensive care nurses at home, which makes perfect sense. And it still cuts the cost by 50% of an ICU bed, and it doesn't cost lives. So please contact us so we can help you to get funding for your child or for your family member who wants to leave ICU. We also provide specialist support coordination for medically complex patients funded through the NDIS. Or if you want to find out how we can help you to get your loved one out of intensive care, including palliative care or long-term acute care, or if you find that you have insufficient support for your loved one or for your child at home on a ventilator, we can help you with that. And we can also help you with funding for our service. We get funding through the Department of Health and other funding agencies. Please send me an email to patrick@intensivecareathome.com. That's Patrick just with a K at the end, or give me a call on one of the numbers on the top of the website. Also, have a look at our career section, and where we're currently hiring ICU and pediatric ICU nurses for clients in the Melbourne metropolitan area and in South Gippsland, Victoria. We are an NDIS, TAC and DVA approved community service provider in Australia. We have also been part of the Royal Melbourne Health Accelerator program for innovative healthcare companies last year. Thank you for tuning into this week's blog. This is Patrick Hutzel from Intensive Care at Home, and I'll see you again next week in another update.